Awesome. All right, we're live. Well, welcome everyone. Thanks for joining us for this first of many, I think, on integrative medicine. I'm Dr. Kaplan. Next to me, we have
Michelle
Adams and
Carrie Fox,
nurse practitioners that are both practicing integrative medicine along with me. And generally, I talk about regenerative medicine. We talk about platelets and stem cells. This is a whole other part of our practice that we are very rapidly expanding into, and I've been practicing now for about 3 to 4 years. And we really haven't brought it to Facebook Live or to the kind of the audience en masse. So I'm excited to present this topic for the first time on the Facebook Live platform and live. We actually have 2 people that are actually in the audience. So it's awesome. So I think we're going to kind of play with questions from both sides. So. And the topic is power of hormones. I just want to take a minute to introduce the practice. Home Integrative Wellness has been basically started in 2014. I started it as mainly a regenerative medicine practice, but very quickly realized that I cannot just take care of someone's spine or someone's joints alone, because of course the person comes in as a whole package. So, ultimately, everything is a symphony. We're a complex creature, and it's a combination of central nervous processing, hormones, body parts moving, and it's just this beautiful interplay that kind of works together. And the exciting thing about integrative medicine is that it really tackles all of that. So on one patient, we'll address, sometimes in one visit, every single thing, potentially, from their hormone deficits to their psychological status to their joint arthritis, and kind of to the nutritional status. And that's what's so exciting, is that's truly what it means to have an integrative practice, when you really are working on all of these things that are truly representative of the person's wellness. Because if any one of those is out of balance, then a lot of times that person is no longer well. That's quality of life, that's enjoyment of playing with their kids, So anyway, it's very rewarding. This practice has been growing very rapidly, and we're just bringing more and more concepts on board that all play into this integrative model. So that's kind of a brief introduction. I'm going to start with a PowerPoint presentation. I'm going to switch off and go into the slide mode here in just a minute. There. So now, yeah. Okay, so the topic of the day is the power of hormones and their role in women's health. I kind of initially wanted to do something that's more broadly of hormones, just in general for men and women, but I thought that such a overwhelming number of folks that are seeking hormonal health of women, that I thought we would target this more to women. And there really is a little bit more to talk about than there is about guys. But the way I want to introduce this topic is to really talk about the conventional approach to aging, because hormones are wrapped up in a bigger package of what is considered to be a normal part of aging and what is considered to be not, right? And in conventional medicine, unless you're on a stretcher, dying, being rushed to the emergency room, you're just normally aging, basically, right? So I'm overstating things a little bit. So, so what do you hear at the doctor's office? Forgetfulness is part of aging, right? Wrinkling and sagging of the skin, normal part of aging, right? Loss of libido, vaginal dryness, erectile dysfunction, just what happens when you get old. Right? Just kind of accept it and move on. It's expected to have less quality of sleep when I get older. I love used to hear this, like, well, what do you're old, you don't need as much sleep, right? So, don't have the same get up and go. It's okay. It's just aging, right? So, and I think we all can relate to that, and we're going to try to show that it's really not quite like that. The other unfortunate trend is in medicine where things get lost in the shuffle is really like, where is the doctor, right? Where is the doctor? So a lot of times patients will come to me and say, I've seen a nurse practitioner, I've seen a PA, but I actually have never even met the doctor. I don't know who they are. Now, it's not all practices, but there are some that are doing that. And it's the trend started when I was leaving my former practice. I was already starting to see that, but I think it's gotten worse. So in this cartoon, you see, the one guy, the examining guy, says, actually, I'm not a doctor, I'm a healthcare administrator. But the patient says, well, actually, I'm not the patient, I'm his attorney. So eventually, you don't even have either in the room, right? Now you have two people playing the role of doctor and patient. So, anyway, so we're kind of, part of this whole drive is to really kind of resist those changes and try to present an alternative picture that I would say a more true to the art of medicine, and also more true to kind of what we all went into medicine for, right? To really take care of people, and not actors playing people. So I love this. This is out of the book Lifespan by David Sinclair that came out a year ago, and it's a wonderful book if you guys are interested in anti-aging at all. And this is a snippet from Alexander Milne, I think is how you say the last name. And, but now I'm 6, I'm clever as clever, so I think I'll be 6 now forever and ever, And I just love that, because I think it really kind of captures the spirit of just wanting to stay young forever, right? And it doesn't have to be necessarily young in some of the negatives of youth, like carelessness and some things, but really in the sense that you have this vitality, kind of the fire in the belly, and the ability to kind of live life to the fullest into the late end stage years of your life, and really that's kind of when you talk about anti-aging medicine, which is kind of an offshoot of integrative medicine, or maybe a subset of integrative medicine. That's what it's about, right? It's about that allowing, that optimization that allows the person to live fully into the late years of their life, maybe being 6 forever. So the next topic, or next slide, is really talking about that rather than accepting age as an inevitable, we want to treat age, or consider treating age, as a disease state, right? And it's kind of a revolutionary approach based on what you hear, in just conventional medical circles, right? Aging as a disease is a concept that really kind of posits that if you treat it as such, you treat the entire concept, the entire process, trying to hold it at bay, prevent it when it's possible. And by doing so, you actually prevent a multitude of diseases, right? And that's where it's at. That's where it's at. Because the current state of medicine and research in medicine is you're working on singular states. And they've done studies that have shown, like, if we cure cancer, right, we've just improved a lifespan of the entire world by something like 1%. That's pretty crazy to think about, right? So yeah, is it important to cure cancer? Sure, right? But just to take that 30,000 foot view for a bit and really say, well, how do we get to it so that the person never gets cancer? Right? Because again, curing cancer means that you wait until they got it, and now you're chasing, right? Age as a disease is a concept that says we're going to treat the problems that are happening as the person gets older, as they build up inflammation, as their cells become senescent, right? Things that drive cancer formation. And if we treat that state, maybe the cancer will never come, right? Which is definitely a lot cheaper in the long run than spending billions and trillions of dollars on cancer research, right? So that's kind of where that's going, right? So this concept of age as a disease defies common practice of capitulation to the process of aging. It argues against complacency that is a product of human tendency to accept status quo and the current medical system's flawed design. Okay, so where are we now? All right, current medical system focuses on isolated disease states, not the whole body, which we just talked about. David Sinclair talks about it. He's a Harvard research and scientist, and he talks about, there's a department for every disease, and not one of those people are talking to the other ones, right? In the same building, right? So it's like you got these cubicles or these boxes, right? And nobody's interacting, Money is spent on treating disease, not on prevention. We just talked about that. Conventional medical wisdom is 20 years behind current scientific advances. 20 years, right? So when we learn something, it takes 20 years for conventional medicine to adapt it into practice. We can't wait that. I mean, that's just way too long, right? So big pharma, again, a little harsh maybe, big pharma brainwash physicians, not everybody, but some are suspicious of anything that is not produced or advocated by mainstream drug manufacturers, right? And in this process, is so systemic that, and again, not everyone is like that. There are physicians that understand that this is something that's being sold to them, but it starts with medical school and residencies with drug sports and lunches, and then you start to get into this concept that this is where the information is coming from, right? This is how we learn, but whatever the drug rep is bringing us with a paper and a product, right? So definitely not a great way to learn, and definitely it's kind of a skewed view of things. So, and of course, hormones is in my mind, is certainly, if not in the very center, it's certainly at the front of the stage of a lot of these issues that go on with aging. We all lose them. That's what you hear. It's part of a normal aging process. Just accept it and age gracefully, right? Okay, so kind of, again, so now, define convention, right? If we all did that, right, 118 years ago, we believed that humans should not fly. Okay? 170 years ago, doctors in the hospitals laughed at the idea of washing hands and the concept of germs, right? Meanwhile, the lifespan, if you could see how it's climbing from 1860s all the way to 2020, from the lifespan of 40 to 80, right? Why is that happening? Because we're edifying convention, right? Well, we didn't listen to people that thought that we shouldn't fly, and we started washing our hands and started to understand the germ theory, right? So again, when we talk about things that are kind of happening now, when you put it in that perspective, especially in the anti-aging and integrative medicine, some of these are maybe novel concepts, but if you don't go forward, you don't go forth, then you're stuck. You're just stuck in one place, right? And that's just not who we are, not what we do as a civilization. So in that belief that age is a disease, it creates a mindset that aging does not have to be a normal part of life, right? We don't have to accept it. Gives hope for shift in the research from single disease state to prevention of cellular aging and dysfunction. Again, kind of summary of what I just talked about. So that just introduces and kind of hopefully presents the hormones, because like I said, they are kind of at the center stage, because we do all lose them, right? We all lose production of hormones as we get older, and you can either accept it and just shrivel up, or you could say, well, I'm not really happy with that. I'm going to do something to keep my hormones optimal, because they are so vital to everything else in my body. And this is where I think we don't learn that as doctors in med school and residencies of how hormones interplay, and therefore our patients don't benefit from that knowledge, right? In conventional medicine, I mean, I remember one of my first pain lectures that I went to, there was a woman who was standing, I think she was part of Mayo, again, conventional, large institution, and she was presenting on role of hormones in pain management. And she was talking about how when estrogen drops, and I'll talk about that later on, progesterone drops, the pain threshold goes down, it plummets, right? And she was saying, we all should be supplementing hormones and treat people. And my first thought was no freaking way, right? I'm not an obstetrician, I'm not a gynecologist, and I'm not a urologist. I'm not treating people with hormones. So that's how we're taught. We're taught to stay in our boxes, in our little cages, but that's not... the doctors and the healthcare practitioners of old treated the whole body. The concept of treating an organ is only as old as, maybe 60, 70 years old. When I was going through medical school, there were family practice doctors that still took out gallbladders and did appendectomies. Can you imagine that now? Right? And it was routine. It was completely routine. They would go see, do a physical on somebody, and then they would go in the operating room and take out a gallbladder. Right? Right or wrong, but again, those doctors were trained to treat the entire individual, right? So we're losing that. So the hormones are involved in every aspect of our health. They're a catalyst of growth, change, energy production, and repair. They're made in anticipation of stress, and they're made on demand, right? So that's very important to understand. We'll lose them as we age, as we just talked about. We'll lose them faster with stress, trauma, abuse, etc. So that's also important to understand. So I've seen, early, like 20-somethings with testosterone levels of someone in their 60s because they had sexual abuse or trauma, for instance, right? And again, if you don't look, if you don't test, you don't know, right? So you could say, when you're just looking at someone's age and you say, oh, well, you're fine, again, without really looking at, really peeling the cover a little bit and seeing what's on, or, and see what's underneath, So cannot understate how the stress in our lives of all kinds really burns hormones out. So let's talk a little about the difference between synthetic and bioidentical. So synthetic, just by the way that it's meant to sound, it's something that is not natural to the body. Now again, all hormones, whether they're bioidentical or synthetic, are made in the lab, but the synthetic really, on a molecular level, do not share very much with our biology, right? So they really are foreign particles. So we have conjugated equine estrogens made from horse's urine. These are examples, not exhaustive, just some examples. Synthetic progestins that are man-made progesterone, not the same as progesterone, again, so not really recognized as a natural molecule within us. And kind of, as I say, the structure appropriate for horses, these hormones are only approximately 30% identical to human hormones, 30%, right? They tend to be inflammatory, right? Rather than actually being anti-inflammatory, which hormones can be. They actually drive our body's inflammation. And in the case of estrogen, they will have a higher yield of a very inflammatory byproduct called 4-hydroxyestrone, right? So, and when they've done studies on any predilection towards cancer development, it's really the 4-hydroxyestrone that is the culprit, right? It's not the other versions. And this is, of course, all kind of conjugated in the liver. So if the liver is toxic, if it's not able to clear inflammatory particles well, right, it will shuttle things more towards the 4-hydroxy pathway. And if you take synthetic hormones, you have a much likelihood of that happening, right? So and again, so it's not as simple as saying, well, hormones cause cancer or hormones don't, Well, what is the byproduct for the hormone? So again, starting to dig a little deeper when we start talking about hormones. On the contrary, bioidentical hormones are typically plant-based, soy or yam-derived, for instance. They're much closer in molecular structure to human hormones. They are typically anti-inflammatory and protective, and they yield a higher byproduct levels of this 2 and 16-hydroxyestrone, which generally are considered to be more anti-inflammatory, more protective, right? So again, it's not just a question of estrogen, no estrogen, it's really which product is it, which byproduct, right? And again, that just a little bit of detail is lost on most of the obstetricians and gynecologists, which is very interesting. I mean, this is basic biochemistry, right? I mean, this is medical school grade biochemistry, but somehow we learn it, we forget it, right? And this is very common. So in some ways, we're kind of relearning what we learned as healthcare professionals in our med school years, right? Because now we can apply it, which is kind of cool, So what are the benefits of estrogen? Well, reduces hot flashes and other menopause-related symptoms. It's powerful as a protectant against dementia and Alzheimer's disease, and I'll show you the next slide, a little bit more detail on that. It does promote cardiovascular health and helps prevent strokes and heart attacks. It does promote healthy bone density, okay? It also helps protect against development and progression of osteoarthritis, and it's critical in skin health. So in part, when the skin really starts to develop wrinkles and the texture of skin changes, the estrogen, or lack thereof, or if you break it down, the estriol part of the estrogen. So Because this is more of an introductory talk, I'm not getting into all the details, but I can mention that there are three kinds of estrogens that are made in the body. There's estradiol, estriol, and estrone. The estriol happens to be very, very important in skin. As a matter of fact, you could frequently find it in skin products. So you can apply it topically, right? So here's an example of this aging concept that you lose your estriol, your skin goes to pot, and it's all okay, right? It's kind of normal to be expected, right? So a little bit, maybe a little hard to read, but this is just basically some research on estrogen inflammation and dementia. Estrogen deficiency in postmenopausal women is a factor in development of Alzheimer's disease. They've done studies, and Alzheimer's, basically the hallmark of Alzheimer's is basically these this activation of these microglia, these inflammatory cells in the brain, and you can actually then study that inflammatory signaling that's happening in the brain. And of course, a lot of that research is done in rodents, and they've shown that just taking the ovaries out in rodents has been immediately connected with pro-inflammatory turning on of these cells that are normally protective in our brain, right? So the microglia are kind of like the white cells of the body in the brain. And those cells can be either protective or they could be destructive, depending on whether they're inflamed or not, right? Take the ovaries out, boom, immediate conversion to a pro-inflammatory cell that becomes destructive. I mean, that's powerful, right? You know? So, and in those same rodents, administering estradiol before the ovary resection blocked that activation. I mean, that's amazing. And, you know, and again, who talks about that, right? I mean, it's just an incredible, powerful thing, right? So, and then, so again, the lack of estrogen augments expression of inflammatory markers observed in women in postmenopause, so that's been shown in human subjects, okay? The extent of this microglia activation, these inflammatory cells in the brain, is induced by ovary resection and is exacerbated by aging. Okay, they've also shown that low circulating estrogens increase the susceptibility. So even if you don't have removal of ovaries, just the lowering of the estrogen levels, right? Just the decline of estrogen levels has been shown for the brain to become more susceptible to aging, into conversion of these microglia to the inflammatory type, right? Which again, when that happens, you got an instant setup for Alzheimer's dementia, right? Which is one of the hardest things to prevent and to treat, okay? And then I have a kind of a reference for this article from this article 2016 that talks about that. So let's talk a little bit about progesterone. Well, progesterone is a very powerful hormone. And a lot of times it kind of plays second to the estrogen because that's what people mostly hear about. But it's no less. You know, it's just as important. It balances it out in its own right. It plays a huge role in memory and mood. Okay, so it increases mood stability and memory. It improves quality of sleep. So one of the first things goes in women that are, let's say, premenopausal, when we talk about inability to sleep, it's progesterone. Right? You know, if a woman has difficulty sleeping because of hot flashes, there's an estrogen issue. But if it's just sleep disturbance, usually it's the progesterone that's lacking that's creating the problem. It reduces anxiety. It lowers blood pressure. It increases health of the hair. It helps with weight loss, reduces inflammation, and improves leaky gut conditions, overall gut health. Right? So, I mean, how many things can you list before you become convinced that it's an important hormone in your body that you don't just want to let go, right? You know, or let go of anyway, right? So here's this interesting study. This is right off the press, 2021, at the Journal of Chest, which is a huge mainstream journal. Progesterone therapy may improve COVID-19 outcomes for men. Well, how does it do that? Well, it boosts the immune system and reduces inflammation and actually blocks the person's ability to go into something called a cytokine storm, which I'm sure everyone by now has heard of, right? Because of COVID. And of course, cytokine storm is basically your body's inflammatory system out of control. It's like a tornado happening inside of cells that the body can't control. So here's your little old progesterone, right? Progesterone decreases gut permeability through upregulation of this very specific molecule called occlutin. And again, this is from 2019, right? So it protects your gut, it protects your body from the cytokine storms and getting inflammation. And by extension, by the way, if your body cannot control inflammation, right? Which means, so let's say if you're lacking progesterone, almost by definition, a body that has an inflammatory process that's out of control is an autoimmune body, right? So this person typically has some kind of an autoimmune condition going on, whether it's recognized or not, right? So you can even tie progesterone as a product that can help prevent autoimmune conditions from forming, just by extension of these studies, right? You can make that leap. Not a big leap to make, you know? Testosterone is huge in men and women. So this is, again, not everyone may be aware of that because everyone thinks of testosterone as a male hormone. But in women, it plays an incredibly important role in libido, self-confidence, and motivation. Okay, it's still very important in muscle mass development, healthy bone mass, reduction of body fat, and bone density. Right. So again, it's kind of the poor cousin of estrogen and progesterone, but it's no less important. Now, for a woman, you know, the need for that hormone is minuscule versus a guy, but it's still necessary and still a very important part of that triad of the hormones. So I'll mention this concept called estrogen dominance because this is what we see very commonly through the entire spectrum of women's aging process, from almost sometimes from teens, the beginning of menses, all the way until late adulthood. You know, so it's a prevalent problem. It's basically where there is a relative excess of estrogen in comparison to progesterone. Okay, and then that can happen for many reasons. In early stages, for instance, in like somebody who's a young, like a 20-something-year-old, right? Estrogen dominance is typically not a sign of lower progesterone production, because if the body's working properly, both hormones should be made in adequate amounts, right? But it's actually something that's called and now recognized as progesterone resistance. So we know about insulin resistance, and that's when the cells are too inflamed to allow the insulin to dock, which means that it can't take up the glucose. But the cells will also be resistant to almost any hormone that's trying to attach to it, right? So you can have estrogen resistance, progesterone resistance, testosterone resistance. So when you have progesterone resistance, it's basically functionally less progesterone, and you go into this estrogen dominant state. As you get older, you are losing progesterone production, and therefore you go into this estrogen dominant state. So you can be estrogen dominant for different reasons. It is associated strongly with endometriosis, okay, and again, something that a lot of healthcare professionals don't look for when a woman comes in with that diagnosis or complaint. Can be present over 10 years before menopause, which I just mentioned. And of course, it's huge in causing mood changes, sleep disturbances, reduction of libido, frequently very heavy and painful periods. Also associated with polycystic ovarian syndrome disease. So again, very, very important condition to recognize, and it's all this imbalance between the hormones that's creating the problem, okay? I'm going to mention a couple of other hormones, really more for completeness sake, and of course, because again, they're all part of the health and kind of the symphony that I talked about. Growth hormone, of course, is vital for everyone's health, and it is the ultimate repair and energy producing hormone. I liken it to a starter on a lawnmower, you know, so basically your cells can be full of nutrients. They could be completely fat and happy, and they'll just sit there, kind of like if you just filled the lawnmower's gas tank with gas. But unless you push the starter button, it's not going to start, right? Well, the growth hormone is the starter button, right? So when our pituitary gland releases a spike of this growth hormone, it starts the cell into action, right? So if you don't have that, you can be full of magnesium and potassium and vitamin C, and it's not going to still work that well, right? So that everything works together. All these hormones play a role, okay? So this is kind of going back to the final comment on the slide. When the growth hormone levels spike, Cells are activated to dump out waste products, repair, and produce energy. So, of course, it does decline as we age. And like all the other hormones we just talked about, it goes down the tubes faster with history of trauma, PTSD, extremely busy and stressful lifestyles. And with use of exogenous hormone. I hear so many comments like, well, how is it different from injection of growth hormone, which is done for weightlifting, for instance? And the difference is that when you have exogenous growth hormone, it's not the body that's making it. So it literally shuts down the natural production of that growth hormone, right? So the person stops injecting growth hormone. There's no growth hormone to be had. So the person goes down the tubes very quickly. And you know, I mean, maybe the brain will eventually start pumping it out, but it takes so long that in the process, the person really, the health of that individual declines significantly. The cortisol is known as a stress hormone. It's vital to our ability to basically fight through stressful situations. It's involved in any what we call fight or flight conditions. It is, of course, very, very actively anti-inflammatory and is a huge supporter of the entire health system. So again, when we have a person in our office, we're checking all of that. We're not just focusing on female hormones or male hormones. We're checking cortisol. Growth hormone is harder to check, but a lot of times we can tell when the growth hormone is not functioning properly or they're at the right levels. So I want to just kind of briefly talk about this whole concept of what happens with cortisol as a spectrum. So in the early, a spectrum of stress, so to speak. In the early stages, the cortisol is super elevated. So if somebody has a trauma, personal traumatic experience, a very busy job, just situation where you have young kids and not a lot of money in the bank, you know, whatever it is, the cortisol is through the roof. And eventually the cortisol is so high that it becomes toxic to the brain, and the brain will literally send signals to the adrenal gland to stop making more cortisol, right? So eventually it's very high, and then at some point it flips into being very low. So in either case, whether it's very high or very low, you have fatigue, sleep disturbance, anxiety, depression, all of those things can be happening in both states. You can be tired and wired, okay? That could be if the cortisol is too high, or you can be just plain tired, okay? So if the cortisol is kind of in the dirt. And it's amazing how well it correlates with the levels that we're checking people. You know, so if we do something called a 4-point cortisol test, where you do a saliva swab, and we do first thing in the morning, we do midday, evening, and then before bed. And what we'll see a lot of times is the cortisol starts out okay, and then around noon it just plummets, right? So I call it falling off the cliff curve, you know. And when the person comes back, you could predict almost to the time, to the hour when they crash. It's really quite amazing, right? Like you could see, look at the graph and say, right about 2 o'clock, you need that cup of coffee, right? Yeah, how'd you know that, right? I mean, so it's an amazing correlation to energy that we have to go through the day, all right? So I'm just going to go through now more of kind of like the cycles and hormone irregularities that women experience kind of through the lifespan, so to speak. So earlier on, we have premenstrual syndrome and premenstrual dysphoric disorder, okay? So those are, again, connected and are associated with something happening in the body, right? That's not allowing these hormones to work properly, right? So it could be a resistance. So the hormones are being made in normal amounts, but the cells are not able to get them, right? To accept them, you know? It could be a conversion of these hormones into something that's more inflammatory in nature, for instance, right? It could be fluctuations that are too high, right? Or not high enough. So these conditions are connected with systemic inflammation and inability for liver to detox properly. It could be connected with thyroid issues as well. Thyroid, of course, is very commonly dysfunctional. There could be this estrogen progesterone imbalance, which we talked about earlier, which is this estrogen dominant syndrome. It could be this progesterone resistance, which I already mentioned, right? And of course, it's associated with lower pain threshold, but that's simply because these wild fluctuations of hormones actually literally lower the physiological threshold of the person's pain, right? So what happens in premenstrual syndromes? Well, if someone has pain, that pain spikes, right? If someone has a predilection to have headaches, when are they going to happen? Right around that time, right? So we see that in medicine. We see that, and we don't typically understand it, right? Or what do? We put them on a birth control pill, right? Which makes everything worse. It may solve things down in a short time, but you have just now introduced another inflammatory agent into the body. So you're saying, okay, I see that your hormones all over the place. I don't really understand that you're inflamed. I just see that it's causing a symptom of pain. I'm just going to put you in a pill and make you more inflamed, right? So just once you understand that, it makes you see how irrational it is, right? But until it's explained in those terms, sounds okay, right? But it still is in this mold of let's just treat the symptoms, right? Let's just treat the symptoms and not worry about the root cause. That's kind of what it's all about, So again, the symptoms of PMS and PMDD: mood swings, heavy painful menses, sleep disturbance, gut disturbance, and many, many more. Again, this is just kind of like a quick overview. So this is a cool case. This is actually told almost in every conference by a woman who's considered to be kind of like the guru of women's health and anti-aging medicine, Pamela Smith. So I'm going to give her credit, but it's just a great story that she tells of this woman, and I think this is the 80s in New York City, who was institutionalized for psychotic breakdown. Okay, and she's kept in this kind of a small room. Did you hear the story?
Yeah, I'm waiting
She
to
tells
see if I recognize
she tells it almost every time she talks. It's a great story. That's why she tells it. So it's a true story. And she's giving her pills to keep her quiet. But what's interesting is that, by the way, this is not 1920, right? This is 1980. Okay, right? Just to give you, there's no sound of like hoofbeats outside, right? There are cars going by, right? So she basically, one of the things that is interesting about her psychotic breakdowns is that they only happen like once a month. Right? And that's kind of curious, right? So, but they're so bad, right, that she was considered to be a danger to herself and others, right? So that was the reason for the institution. And I think her family basically put her in this institution. So, she has a radio, she's listening, there's a program on, and there's a woman, I think a gynecologist, that talks about hormones and how it's this inflammation, right? And it's this resistance to or impairment of the body's ability to process hormones properly that leads to this dysmorphic disorder that can be so severe that can cause these psychotic breakdowns. And by the way, it happens right before your menses, right? She gets this aha moment, and she goes, "Wait a minute, I'm not crazy. I have a premenstrual disorder," right? So she gets so excited that the people think she's agitated, and they put her in a straitjacket so that she doesn't harm herself, right? What she happened to have befriended a custodian in the institution, and she pleads and begs with him, right, to let her out of the jacket. So he lets her out. She runs away. Right? She has a gown. She's completely naked underneath. Right? She's got a gown flapping in the wind. She escapes from this institution. Right? She's running down the street. Right? And basically ran out, and there was a woman that was standing with a purse on the ground. She steals this woman's purse just to have money, grabs a bus, and checks herself into a hospital. Right? And she goes, "I know what's wrong with me." And sure enough, she makes it to a clinic. They put her on progesterone. It was probably progestin at the time. And she's fine. Right? So there's an extreme case of our, society not understanding, right, how these natural conditions can cause some amazing problems, totally misdiagnosing somebody. So I just thought it was a great, kind of like an extreme case of PMDD, right? And by the way, I mean, I can't remember the full story, but she became like a writer or something. It was like a totally high-achieving individual who was locked up, basically. So that's kind of in the way in the premenopausal phase. And the perimenopausal phase, which basically means that you're kind of at that stage where your hormones are starting to dwindle a little bit, they're sputtering a little bit. You are starting to see some changes in the way you feel, the way your body looks, the energy levels that you have. These perimenopausal changes can happen as early as mid-30s. So again, it's not like right before things shut down, Changes are often seen not only with, initially seen with reduction of both testosterone and progesterone, right? So the estrogen will tend to stay elevated fairly high, but the testosterone and progesterone will frequently start to drop, right, in this premenopausal phase. So then, what do you go into? Estrogen dominance, right? Which again is pro-inflammatory, right? So what's interesting about this is, and you guys, the women in the room can tell me this because I witnessed it in so many cases. But again, as a male, I'm an observer, is that some of these behaviors that women had before childbearing, right? And it used to be thought it was really just because you now have children, right? There's a change, right? So women tend to be less risk-taking, right? It's not as big of risk-takers, right? More risk-averse. There could be less assertive, right? All of a sudden, maybe their memory is not as sharp, right? Or their concentration is not as sharp. And if you go to a doctor with those complaints, doctor, I used to jump out of airplanes, now I'm afraid of being in a car that's going faster than a scooter, right? Well, what do they say? Well, you had kids. That's what happens when you have kids, right? It's one of those things like, this is just a normal state for you. Right? The fact that you used to jump out of airplanes and now you're afraid of being in the airplane, that's just normal. That's not normal, right? How does a person go from one to another? It's a hormone change, and it's not a normal one. So I think that's so insightful to think about that. These are not normal changes. Now, of course, and again, what happens is you chalk it up to, well, now you have kids. So, of course, now you have a responsibility. And that's true, of course, right? You're not going to go out there and do things that you would do before kids, but it's more than that, right? There is a hormonal undercurrent there, So it's kind of a little bit of a food for thought, right? And it's frequently also accompanied with gut issues. The gut problems a lot of times start in the premenopausal phase. And again, remember what I said, your progesterone starts to drop, and what is the key role, one of the key roles of progesterone? Gut health, right? And again, what happens in a regular medical visit? Nobody looks at progesterone. They just start giving you something for constipation or something for diarrhea. Again, we're treating the symptoms, okay? So now we're going to go into post-menopause. Obviously, an eventual decline in all major hormones across the board. And as soon as that happens, what studies have shown is reduction of cognitive function, increased risk of dementia, like I talked about the role of estrogen in dementia earlier on. Sleep impairment, of course, happens before that, but certainly becomes worse with menopause. Gut impairment gets worse. There's a lot of complaints of vaginal dryness, pain with intercourse, loss of libido. Now you have increased risk for osteoporosis and also increased risk of cardiovascular disease, right? It's not all hunky-dory. And again, this is interesting. Women that have very, very, I would say, turbulent menopause, right? When they are like, I'm sweating, I'm hot, I'm going to kill somebody, that kind of thing. They get attention, right? They'll go to a doctor and say, if you don't put me on something, I'm going to kill somebody, right? So they're like, okay, I'm going to put you on something, right? But there are a lot of women that sail through this with no problems whatsoever. Like my wife is like that. She never had anything, right? So then those are in some ways are worse because they completely fly under the curve. right? So, like, well, you don't have any problems. You don't need to be on anything. Wait a minute. Whoa. How does not having hot flashes equate to not having increased risk for dementia, not having increased for cardiovascular problems, osteoporosis, and everything else we just talked about? Just completely unrecognized. Completely unrecognized, right? So again, just kind of are allowed to just dry on the vine, right? Just shrivel away, basically, right? So this again is why we supplement with hormones, right? It's this, like as I said in the introductory slide, it's this resistance to capitulate to this concept that the aging is a normal process, right? So hormone supplementation is optimization of all essential functions, right? And truly allows us to age gracefully. Not what you hear, right? Accepted and age gracefully, right? So, here we go. So I actually talk about how to supplement. So when we supplement, as far as estrogen is concerned, we typically are supplementing two main estrogens, estradiol and estriol, okay? They are frequently compounded together, okay, in a cream form. They can also be put in a pellet, okay? They're very effective as a vaginal cream for dryness, so it can be done that way as well. They're typically taken 6 out of 7 days a week. This is post-menopause, of course. And usually if it's a topical compounded cream, the way we know that your hormone is optimal is through actually a saliva test, right? Because this is, saliva kind of represents what's in our tissues, not what's in the blood. So when you put something on the skin, it goes into the tissues directly. It's not really circulating through the blood. So we really can't accurately test it through blood. We need to test it through saliva. And that's typically done every 3 to 6 months. So this is what we start talking about, kind of concerns, right? Because I kind of threw that in there right after the estrogen for a reason. Because as soon as you talk to a person about hormone replacement, the first thing that the woman says is, what about cancer, right? What about blood clots? Everyone's heard of it, right? I mean, it's not like, this is not little news. This is all over the place, right? So studies have shown that bioidentical hormones really do not predispose women for high incidence of cancer. So this is a review in 2017 in a study called Climacteric. So this is where I'll do a little bit of kind of research. And it basically shows that transdermal route of estrogen administration avoids excess venous thromboembolic and ischemic stroke events, right? So it avoids that heightened risk of strokes and clots, right? There's some indication that conjugated equine estrogens, so those are the synthetic estrogens, are more thrombogenic and most likely induce some hypertensive responses, meaning that it can cause spasms in the arteries, which drives your hypertension, which of course can set up an event for stroke. And thrombogenic basically means that you're more likely to develop a clot, a thrombus or a clot in the vein. Okay. Estradiol may also be superior to conjugated equine estrogen in terms of global cardiovascular health, right? So these are large reviews, right? So this is by this Lermite and others, and they basically looked at, I believe, like 60 plus studies, right? So these are kind of meta-analyses where they look at all these studies and they come up with like a compilation or recommendation based on these studies. What about cancer? Okay, and I apologize, the print is a little bit small here. But again, I'm just going to read through them because it's just so important to understand. The most valid evidence presently suggests that even the conjugated estrogen, right, so even the synthetic estrogen, if administered alone, does not increase the risk of breast cancer and may even reduce it. This flies into the face of everything that's been kind of talked about and really taught in maybe the last, 15 years, 20 years, right? Because that's, when I was going through medical school, and 120 years ago, so the early 1990s, everyone was put on hormone replacement. It was synthetic, right? And then you started to have incidents of breast cancer and ovarian cancer, and then everybody stopped putting people on hormones, right? It's all or nothing, right? And because some of these studies show increased incidence, but they were with synthetic progestins, not just estrogen alone. And of course, again, they were synthetic hormones, which act very differently in the body. Remember, only 30% similarity to our hormone than the bioidenticals, okay? The combination with synthetic progestin, okay, is the critical issue since it seems to be primarily associated with increased risk of breast cancer. So it's the synthetic progestin that's the culprit, right? And we still are putting all our women, right, on progestin. Even though the evidence is, and again, this goes back to this concept that it takes us 20 years to assimilate new knowledge, and we can't really do that, right? So you can't wait 20 years and keep putting people at risk, However, again, this is very important. Even with this increased risk of a progestin, it may appear to be similar or still lower than the associated risk from lifestyle factors. So this is huge, right? What this is saying is that you eating processed foods, smoking, right, will put you at greater risk of cancer than the progestin that you're on, the synthetic progestin, right? So this is kind of like, I just came back from an advanced cancer IV course, and this one woman who's brilliant talks about this terrain of the person, right? And it's all about this fixing the metabolic terrain. And when you clean up the terrain, the diseases kind of take care of themselves. And it goes back to this aging as a disease process. It's kind of all kind of ties in, But I think it's a huge, huge thing for them to say in this conventional study that the lifestyle factors are the huge elephant in the room, right? It's not even all about the hormones, right? You could take the hormones, but if you eat, live cleanly, you're still going to have a fairly lower risk, right? Which is pretty amazing to say, So though not yet proven in a randomized control study, okay, the hormone replacement that's bioidentical continuously combining with micronized progesterone. So it's this combination of micronized progesterone and estradiol can presently be considered as the optimal hormone replacement therapy. Okay, so this is again from 2017. So I think hopefully that starts to, again, it's not certainly the end of the conversation, but at least it starts to present some data, right, that we have now. Because, a lot of times you hear that, well, there's no data on bioidentical hormones. Well, now there is. It's growing. It's not perfect, but it certainly is now, the body of that literature is growing very, very quickly, So let's talk about progesterone. We put women on progesterone, unlike estrogen, that we don't put women on until they reach menopause, right? Because they typically make their own. The progesterone, because it does decline very early, can be started very early in life, right? So in your 20s, right? Just depends on the amount. And of course, there you want to cycle it to work with a woman's cycle, right? So you're going to put a woman on progesterone days 12 to 24. In postmenopausal phase of life, it's typically done not cyclically, but 6 out of 7 days a week to just give a person a little bit of a holiday from the hormone 1 day a week. It could be either oral or cream, okay? Most frequently, it's given as a pill for a couple of reasons, okay? It can be combined with estrogen in a pellet form, and there is a difference in how you take it, basically just by kind of the standard, the way it's considered the best practice right now. If the person's put in the pill, it's generally taken at night, and if the person's using the cream, it's generally used in the morning. So there is a difference in how you take it as well. So again, here's a little bit of cancer concern as far as progesterone goes. So the estrogens combined with progesterone, okay, that's micronized, meaning that bioidentical progesterone, do not increase breast cancer risk for up to 5 years of treatment duration. This is, again, a review from Climacteric in 2018 by this Stute and others, okay? There is limited evidence that estrogens combined with progesterone, not synthetic, but bioidentical progesterone, applied for more than 5 years, let's see, there's limited evidence, right? So meaning, again, they're saying the same thing. There's limited evidence that there's any increase of breast cancer. And combined hormone therapy, okay, of course, when we cover, even when we're doing any kind of safe coverage, what we consider to be a safer way of administering hormones, of course, there's always a discussion of breast cancer risk, ovarian risk, regardless of the progesterone chosen. So this is just kind of best practice recommendation that even though we think that this is a very safe practice, we still will always talk about cancer and such. And we'll even go, but we'll go as far as doing some genetic testing to see if there's any familial predisposition, which makes us much more comfortable, right, in going forward with that. Even though, again, the data suggests that there's essentially very little to no risk at all, okay? And again, this is impact of micronized progesterone on breast cancer risk, a review from Journal of Climacteric Medicine, 2018. So, it also, again, this is another study from 2016. These are all kind of these analyses and summaries on benefits of progesterone. Oral micronized or bioidentical progesterone provides endometrial protection, right? So it protects you from uterine cancer, right? When it is applied sequentially for 12 to 14 days per month at 200 milligrams per day for up to 5 years, right? So now we're starting to see, and again, because there is a trend in traditional medicine to put women just on estrogen, right? And not a great trend, right? And this is one of the reasons why, right? Because the progesterone is protective against cancer, specifically endometrial cancer, okay? Vaginal progesterone may provide endometrial protection if applied sequentially for at least 10 days a month. Transdermal progesterone does not provide endometrial protection, okay? So this is one of the main reasons why we prefer the oral form of progesterone, right? Because they've actually done studies and kind of figured out that the oral is protective and the cream version is not. So the only reason why we'll do topical progesterone is if a woman really just cannot tolerate the pill form, which sometimes can happen, so, but again, fairly rare. I don't know if there are any questions on that question. If you'll see the questions pop up right there. So testosterone, again, we always look at testosterone levels in a woman just like in a guy. They can be compounded in a topical form. They can be actually mixed with the other hormones. They can be also compounded into a pellet form. And again, because it's a topical application, they're typically tested through saliva as well. So even though the main topic of the talk today is about just hormones, the next portion of the talk is really all about lifestyle, okay? And again, that alludes back to that one reference in the study where they talked about how the lifestyle presents a much greater risk of cancer than anything else that we do, including hormone supplementation, synthetic even, right? Synthetic hormone supplementation. And the hormones, when we try to balance them, they cannot be balanced without establishing an efficient metabolism, right? So we cannot do that. So when a woman comes to our clinic for basically hormone replacement therapy, it's never just hormone replacement, ever. There's never a time when we'll say, okay, here you go, here's your prescription for your estrogen. We're going to look at their inflammatory markers. We're going to talk to them about their diet, right? We're going to understand their sleep patterns, so I'll kind of go through that. Their gut function, which is huge, okay? So gut health, right? Our gut is basically our primary barrier between the outside and the inside, right? Because between the outside world and us, right? So they cannot be more critical organ in the body, right? Because of that. Obviously, all organs are important, but this is our main protector, right? And when the gut breaks down, all of the pathogens and toxicants, and things that are not good for us are now flowing freely through the gut lining into our bloodstream, and then they're wreaking havoc with our body, right? So kind of like the idea, right? So aside from the fact that it doesn't feel good when you have a gut problem, you have all these systemic issues, of course, as well, okay? So we know that stress and inflammation leads to increased permeability of the gut, or as mostly now it's known as leaky gut syndrome. We know that reduced estrogen leads to more permeability of the gut and progesterone as well, okay? The gut problems in and of themselves then lead to more inflammation, okay? And then that leads to hormone resistance, right? So as your gut breaks down, you become more inflamed, and as you become more inflamed, the hormones that your body is making, your body's not doing it efficiently, right? So now you have hormonal problems, but guess what? They're coming from the gut, right? So it's very important to understand that, right? You can have a liver problem. You can have, and again, usually it's inflammatory. You could certainly have cirrhosis or you have fatty liver disease, but you could just have a normal liver, but it's not functioning properly because it's so overwhelmed with inflammation and toxin clearance, right? So poor liver detox we talk about. And of course, constipation. Constipation is, again, you literally cannot put somebody on hormone replacement if they're constipated because they're not clearing, and if the liver happens to convert the estrogen into this bad component, 4-hydroxyestrone, you would want that to be cleared very quickly through the stool, but guess what happens when you're constipated? That bad byproduct of the estrogen is now sitting in there, and then of course it's going to go reabsorb back through the bowel because it's not being evacuated into the bloodstream, creating inflammation and potentially setting you up maybe for risk of cancer and other problems, right? So again, this is how critical gut health is in hormonal health in general. So we have other issues that come with just unhealthy lifestyles, and those are exposures to xenoestrogens. Okay, xenoestrogens are basically synthetic molecules that look, smell, and feel like estrogens, right? So what happens is when the body sees them, it accepts them docking onto the cells, onto the receptors. And of course, when that happens, the actual estrogens can't dock, right? So then you have a big problem. So they are kind of in a family of what we call endocrine disruptors, right? So disrupt how our hormone system works in the body. And we get exposed to these xenoestrogens through genetically modified foods, all right? Not because they're genetically modified, okay, but because genetically modified foods were modified for a reason, right? But they were modified for a lot of reasons, but one of the main reasons is so that they could withstand spraying of herbicides, right? So if you genetically modify a grain so that when you spray it with Roundup, it doesn't die, but the weeds die, you have an industrial complex that can then produce a lot of grain with a lot less work of trying to clear the weeds, right? Concept, right? They also found that if you spray glyphosites, which is Roundup, earlier on in the process, it actually facilitates maturation of the grain, so you can cultivate it sooner, right? Well, I'm sorry, the other way around. Early on, you sprayed it to get rid of the weeds. Later on, you're spraying it to now speed up the maturity so you can cultivate it faster, right? So it's very interesting, right? And of course, that typically stays on the grain. We ingest it. There are lawsuits going on in California with people developing cancer from Roundup. It's a huge gut disruptor. It disrupts it disrupts the junctions that hold our cells together, which creates the leakiness, right? And it's an antibiotic. It actually has a very powerful antibiotic property. And of course, if you are ingesting an antibiotic, it's killing off healthy bacteria, so it's creating a problem in that realm as well. So it's like a double whammy, right? So there you go, right? So GMO foods, and of course, again, they carry these xenoestrogens, right? Red dye and food preservatives as xenoestrogens, plastics as xenoestrogens, cosmetic products, all of those compete with your natural hormones, right? So again, if you're not If the diet is not where it should be, right, or your lifestyle is such that you're exposed to a lot of the toxins, it's going to be very hard to balance your hormones, right? So it's just kind of part of the deal, right? So the diet that's inflammatory in nature is typically very rich in grain-based carbs, processed foods, and artificial sweeteners, right? This is kind of a short trio here. So when we talk to women about hormonal health, we are talking to them about anti-inflammatory diets that eliminate or reduce a lot of these components, right? So the other thing that drives our hormones wacky is basically being constantly stressed, right? Fight or flight, which a lot of us are perpetually in, right? And it is a perpetual stress response. And you go from being stressed at work to being stressed while you're driving in the car because somebody cut you off, you listen to the news, that's pissing you off, right? To being stressed at home because your kids just whatever, or your dog ate you or whatever, right? So there's a constant stress response. And then to relax, you go on your phone and then you read some more disturbing news right before you go to bed, right? So perpetual stress response, right? So we know that this perpetual stress response depletes all hormones. It just burns right through them, okay? And of course, it's a huge disruptor of gut function in its own right. So there you go. There's the feed into the system, right? Kind of making that loop. Poor sleep is a huge component of hormonal imbalance, okay? Inconsistent schedule, so not keeping a regular sleep schedule, right? Inadequate sleep, so not getting enough hours, which are two different problems, right? Disrupted sleep, so you may be consistently going to bed at 10, and you may try to get 8 hours of sleep, but you keep waking up, right? And then your net is 4 hours, and this, not of a monitor, we have wearable devices that we recommend our patients get that monitor sleep, and we're now monitoring sleep with them, and you can actually now see how much they sleep, right? Which is so eye-opening, right? So you could, and again, this goes back to this concept of personalized medicine or precision medicine, where it's not just about just taking a person's word for it, right? But actually looking and seeing, right? Because it's one thing to say to the person, do you get enough sleep? Yes. Okay, next question. Right? I mean, that's what happens, right? Or, well, how many hours you get? And they'll say, I get 7 hours of sleep. And you say, okay, that's okay. That's kind of in that realm between 7 and 8, so you're fine. It's a completely different story of looking at their sleep map, so to speak, and see that out of those 7 hours, they had 3 hours of awake time, or 2 hours of awake time, right? So now they're getting 5 hours of sleep every night. They're completely sleep deprived. They don't even know it, right? Because for them, that's become a new normal a long time ago, right? So this is how they function now, right? On 5 hours of sleep. And I see it. I mean, these are real cases. I mean, I look at people's phones or they send me the data and they're like, your awake time is 2 hours. You're literally in bed, and out of 7 hours, you're awake for 2 hours. And it's not solid 2 hours, that's why people don't recognize it. It's these it's sprinkled throughout the entire night, right? So that's what's interesting about it. It's not difficulty falling asleep where you're kind of like awake and you just lay in there. It's actually you fall asleep, you wake up, you don't even realize that you spent 2 hours out of that nighttime cycle being awake. Which is pretty amazing, And then the other thing that's a huge disruptor is this blue light exposure before bed, and that's something we're talking to people more and more about. And this is your screen time, right? Your computers, your television, your phones, and it's inflammatory. It's inflammatory to the brain. It raises cortisol levels, and it really sets off this cascade, right? Of leaky gut. Insulin resistance, hormone resistance, everything we just talked about, right? So fight or flight. By the way, if you're sleep deprived, what are the odds that you're going to be in a constant state of stress response just from being sleep deprived? You're going to be stressed because you're not sleeping, I mean, there's a great example of that. Somebody who had sleep apnea, for instance, right, and didn't know it, and then they got on the sleep apnea machine, all of a sudden they're like, oh my God, I never knew I could feel so good. I'm not stressed. I mean, the sleep is, obviously, right? Stating the obvious here is essential for everything, right? So when we talk about hormone support strategies, again, in addition to providing hormone replacement or optimization is probably a better word, right? We do talk about an anti-inflammatory diet, optimal sleep and pre-sleep hygiene, exercise, reduction of insulin and hormone resistance through multiple kind of vehicles, which then lowers inflammation, improves detox, and then helps the hormones function better, okay? And then we always, as part of that, we talk about detox or fasting. It's just one of the ways we're going to help the body get rid of the inflammation. Stress reduction, of course, is huge, okay? Meditation and mindfulness is a very potent stress reducer. Breath work, so we actually now ask people to schedule that in their day, like to put on their phone. We'll typically tell people 5 minutes, 2 to 4 times a day. You will go through a breath exercise, right? So, and we'll typically give people like 3 different breathing exercises just to cycle so it doesn't get boring, But of course, we can come up with many more than that, but at least you give them 3, because usually we're all creatures of habit. If you tell them to do one thing, then people just keep doing that same thing over and over again, right? So it's like, unless you give people a license to go, it's okay to mix it up, they just won't, So, and of course, moving meditation, which would be like yoga or Tai Chi, those are amazing stress reducers, and they're all anti-inflammatory, and they just make everything work better, and it's really that symphony of all of these corrections. And then, first of all, if your body's making hormones, then those hormones are going to work better, and if we're supplementing, then of course our supplementation is going to be much more consistent, much more effective. So kind of a whirlwind tour of hormones and lifestyle, but we're kind of come to the end of that. So I don't know if we have any questions from Facebook. I'm going to flip out of this mode here for a minute. There we go. All right. So, see any questions online? Any questions from you guys?
Yeah, it was very interesting. I mean, I have always, I'm 65. Don't tell
Don't tell anybody.
But
I'm recording now.
Well, you don't know who you are, so it's okay. It's anonymous. It's anonymous. Yeah, it's all good.
But yeah, so I'm one of those people that never had hot flashes or anything like that. But I always feel like, there must be something I need to do something about, because I occasionally have trouble sleeping and things like that. And I know that my hormone levels have dropped. But I've been afraid to do anything, because my sister passed away with breast cancer. And I have been told by several doctors that, the bioidenticals act the same way as the, synthetic. And
Exactly right. Yeah.
I just.
So that's an interesting thing. So this is where we will do like a genetic test, the BRCA test, right?
Yeah.
Because if you didn't get that.
I did get
You
that.
did get it. Okay. And was it positive?
No, it was negative.
There you go. Right. So there's the lifestyle.
Right.
Right. So I mean, you hear this over and over again, and whether it's a sister or a mother, right? And our conversation is always the same. You're not your sister, and you're not your mother, right? And if you live a different lifestyle, it's usually what happens, right? You don't have these genes being turned on, right? So again, it's that. So we call this epigenetics, right? So epigenetics is again something that has been around for 20 years. I did not learn in medical school, but it's basically the genes responding to external factors, right? And then those external factors actually then either turning on or turning off the switch on that gene, right? So if you have a breast cancer gene, right, that breast cancer gene will never get turned on if you don't have these environmental factors playing the role to turn it on, right? So the epigenetics, And what's interesting is our genes are expressed and overexpressed and underexpressed like a million times a minute. It's just an amazing thing. It's a constant interplay between environment and genetics, which is again so new as a piece of information, because we always thought we were born with these roadmaps, right? And well, you have your parents' cholesterol, or you have, right, you know, that kind of stuff, right? Runs in your family, right? But that's not it, right? That's, if you live like your parents did, and you repeat those same patterns, right, you're going to be in that same boat, you know. But we see this, and this has been proven over and over again. Yeah, it's the role of epigenetics, right? So if you have a different lifestyle, you will not let those genes turn out.
Yeah,
right?
fighting it.
Right, you know what I mean? So that makes a big difference. Makes a huge difference. So to us, like if you came to us and said, well, what about it, right? If we checked your BRCA gene and it was negative, we'd be very comfortable putting it on bioidentical hormones. Understanding that we also want to make sure that the lifestyle is appropriate. Right, you know, and then kind of it's all working together. Right? And we can also now, you know, I talked about how you can have these byproducts of estrogen, right, that can either be kind of good or bad, you know, you put it oversimplistically. You could do a metabolite test through the urine that will show whether you're converting to that bad estrogen. Or not, right? So that gives extra power, right? So like if you say, well, I'm really kind of concerned about that, and say, well, we can actually monitor that. Right? Because if you're metabolizing primarily to 2-hydroxyestrone, green light, right? Your body's humming.
We can modify that as well. If you were metabolizing to the not so good estrogen, the 4-hydroxy, we can do supplementation or make adjustments to get you metabolizing down the right pathway. So I think one of the big keys is also monitoring closely with our clients, what they're doing, how they're feeling, follow-up testing, and answering questions and adjusting doses to, you know, meet the needs of the protection all the way around, the good and the bad.
Yeah, that's fantastic. I mean, yeah, because I mean, I know I'm tired, like a lot of those things, and losing muscle. I mean, I lift weights, but it's not how it used to be, you know?
So there's your testosterone in play potentially, right? You know,
need to get it all checked.
right? Well, again, testosterone is, in the conventional world, who thinks of testosterone as a woman's hormone, right?
Yeah.
Nobody. But I remember when I was first learning about hormones, there's this Belgian doctor that does a lot of hormone replacement lectures. And he talks about how his wife, who was like a corporate lawyer, I think, or something like that, slaps on extra testosterone before she goes into a meeting, so she could like be up there with the men, right? Push back. So it's very interesting. So, but that's how interesting in the media it can be, right? I mean, so these are so eye-opening, right? When you start learning that stuff, you're like, wow, these are life-changing things, right? Foundational things. And you know, like you talk about testosterone, you know, we all run with a certain amount of testosterone. We developed and we are running on a certain amount, and we get used to that certain amount, right? And it's different for everybody, right? And this is a nuance of hormone optimization, is that if you had a lower level of testosterone your whole life, your body has now accommodated to that, and it can function just fine, right? And again, so this is a good point to make, that that's why it's better to be called hormone optimization therapy than hormone replacement therapy, right? Because you came with a set of hormones, right? And then your body was used to functioning on those hormones, you know? And when those hormones are in decline, now your body is not functioning now like it used to anymore, because it was calibrated to that level, right? So both for men and women, if you were running on a higher level of testosterone, obviously different for both men and women, when that testosterone drops, you feel it as you get older, right? So what are we doing when we're putting you back in testosterone? We're optimizing, right? We're giving you what your body's used to doing, you know? So like in the guy, it's a little bit more straightforward, but this is why labs are so inaccurate on their own, you know. So we'll look at let's say a total testosterone level kind of is considered the benchmark of 800 is like normal, right? 800, But what if a guy in his 20s had a testosterone of 1500? Is 800 normal? No, right? So how much of hormone therapy is typically covered by insurance? Okay. Well, so
What was the question?
how much of hormone replacement is typically covered by insurance? So I think from the standpoint of progesterone,
That is typically covered
Maybe.
often with a copay. That depends on the source of the progesterone, however. It is available in a standard pharmacy, your local Walgreens or Walmart. However, it's in very fixed dosing, and we often want to customize the dosing based on what you need, based on your symptoms and your lab work. So oftentimes we don't start with a standard, let's say 50 milligram tablet that might be available
Or
to you,
100.
or 100 or 200, but they're very regimented in the dosing, so we don't have a lot of room to adjust based on your needs. And maybe you don't tolerate 50 milligrams, maybe you need 40. So we do typically use a compounding pharmacy for most of the bioidentical hormone replacement therapy because it is so customizable. And sorry, I'm not looking at the camera. It is customizable to each client's needs based on how they're feeling, what their blood work looks like. And initially, we usually only prescribe 1 month's worth at a time until we get you to the right dosing. But then you can get a 3-month supply, kind of just like your standard medications. It's usually cheaper to get them for 90 days versus 30 days. So that can bring the cost down
quite a bit.
over time.
Quite
Yes,
a
quite a
bit.
bit.
Quite a bit.
1 month of oral micronized progesterone might be $30, but a 3-month supply might be about $50 to $60. So it can be quite a savings there and easier and all those things. So there are variables. The estrogen is typically not covered, the topical compounded estrogens, because it is specialty pharmacy type.
And I think like a 3-month is what, like $80?
Between $80 and $100 for a 3-month supply of the
And
estrogen.
again, so you think about it,
It's an investment.
it's an investment, but it's not thousands of dollars, right?
Right.
So.
We spend more than that on our daily coffee.
Yes.
For sure. Good point. Good question. I think that in general, as far as coverage for the bioidentical hormone optimization approach, as you could tell, it's so comprehensive and it requires so much looking into and so much time of working on people's gut and their diet and their sleep and their stress. None of that stuff is covered under conventional medicine. It's just no one has the time. The doctors in the conventional setting just do not have the time to go through all of that with the patient. It's because it's the typical visit for us is an hour to start with, first especially initial, and sometimes some of the follow-ups can take an hour if they're more complicated. If it's a quick visit, it's 30 minutes, which is long in the conventional setting, right? Our short visit is a long visit, right? Like for instance, I spend a little bit of time at Dent, 1.5 days a week, I guess. And for me, my initial visits, which are my long visits, are half an hour. Right? Here, that's my short visit. That's my follow-up. That's when everything's going okay. So just to give you a sense of why these are not covered, because it's just, the insurance companies will never pay for that kind of time. So, all right. Well, any other questions? If not, we'll sign off. Thanks for joining us. And by the way, just going on our website, homeintegratedwellness.com, we have an integrative medicine section. There's a section on hormones, section on just our overall approach to integrative medicine and wellness. So feel free to visit the website, drop us a line, or come by and visit. We're always happy to answer questions. Thanks so much. Have a good night.
Good night.